Hello and welcome. Today, we're going to explore a topic that almost everyone faces at some point in their lives: wisdom teeth. Whether you're a teenager, a young adult, or just curious about dental health, understanding wisdom teeth can help you make informed decisions about your oral care. So, let's dive right in and unravel the mystery behind these infamous molars. First, what exactly are wisdom teeth, and why do we have them? Wisdom teeth are the third set of molars located at the very back of your mouth. They usually make their appearance between the ages of 17 and 25, which is why they're often associated with the transition into adulthood. In fact, some people call them third molars, because they come in after your first and second sets of molars have already settled in. For most people, wisdom teeth are the last adult teeth to emerge. You might notice some pressure or discomfort at the back of your mouth as they start to push through the gums. This is completely normal, but it's important to keep an eye on how they're coming in. Typically, people have 4 wisdom teeth, one in each corner of the mouth right at the back. However, it's not unusual for some people to have fewer, or even none at all. Genetics play a big role in how many wisdom teeth you develop, and some people are lucky enough to avoid them altogether. When wisdom teeth grow in perfectly straight and there's enough space, they can function just like your other molars. But, more often than not, our mouths simply don't have enough room to accommodate these extra teeth. This lack of space can lead to a variety of dental issues. Imagine your mouth as a parking lot that's already full. By the time wisdom teeth arrive, all the best spots are taken, and there's nowhere left for them to fit comfortably. This can cause them to push against neighboring teeth, leading to crowding and discomfort. Sometimes, wisdom teeth don't have enough room to fully emerge. When this happens, they can become impacted, which means they're trapped beneath the gum line or grow at odd angles. Impacted wisdom teeth might only partially break through the gums, or they might stay completely hidden, causing problems below the surface. Impacted wisdom teeth can lead to a range of issues, including pain, swelling, infection, and even damage to nearby teeth. You might notice soreness in your jaw, difficulty opening your mouth, or swollen gums. In some cases, cysts or other complications can develop around impacted teeth, making it important to monitor them closely. But why do we have wisdom teeth if they cause so many problems? The answer lies in our evolutionary history. Our ancient ancestors had larger jaws and needed extra molars to help chew tough, raw foods. Over time, as our diets changed and our jaws became smaller, there simply wasn't enough space for these extra teeth. Today, wisdom teeth are considered vestigial. They're a leftover from our evolutionary past and aren't as useful as they once were. Because of these changes, wisdom teeth often require special attention from dental professionals. Dentists and oral surgeons keep a close eye on how your wisdom teeth are developing, and they may recommend removal if they're likely to cause problems. This is a common procedure and can help prevent pain, infection, and other complications down the road. In the next chapter, we'll take a closer look at why dentists sometimes recommend taking wisdom teeth out, what the removal process involves, and how you can care for your mouth before and after the procedure. Stay tuned to learn more about keeping your smile healthy and pain-free. Why might your dentist suggest removing wisdom teeth? The main reason: not enough space, leading to impaction. Impacted teeth can push against others, causing pain, crowding, or even damage. Partially erupted teeth can trap food and bacteria, leading to infection called pericoronitis. Sometimes cysts can form around impacted teeth, risking damage to your jaw or nearby teeth. Dentists may also recommend removal as a preventative step, especially if X-rays show future problems. It's often easier to remove wisdom teeth when you're younger, before roots fully develop. Removing them early can prevent bigger issues down the road. If you need your wisdom teeth removed, you'll meet a team dedicated to your care. Your general dentist will take X-rays and assess your teeth. Simple cases can be handled by your dentist, but complex ones are referred to an oral surgeon. Oral surgeons are experts in these procedures and will explain everything before surgery. During the procedure, you'll also meet dental nurses and possibly an anesthetist if sedation is needed. Each team member has a specific role to keep you safe and comfortable. They'll answer your questions and make sure you feel at ease. You're in very capable hands. Preparing for your wisdom tooth extraction is one of the best ways to ensure your experience is as smooth and stress-free as possible. Taking a little time to get ready can make a big difference in your comfort and recovery. Start by marking your surgery date on your calendar and reviewing any instructions your dental team has provided. This helps you feel organized and confident as the day approaches. One of the most important things you can do is arrange for a responsible adult to drive you to and from your appointment. After surgery, you may feel groggy or disoriented, especially if you've had sedation or anesthesia. Having someone you trust by your side not only ensures your safety, but also gives you peace of mind. Ask your friend or family member to stay with you for a few hours after you get home, just in case you need help. Carefully follow your dentist's instructions about eating and drinking before surgery. If you're having sedation or general anesthesia, you'll likely need to fast for several hours beforehand, usually no food or drink after midnight. This is important for your safety during the procedure. Set reminders for yourself so you don't accidentally eat or drink too close to your appointment time. Before your surgery, stock up on soft, easy-to-eat foods that won't irritate your mouth while you heal. Think soups, yogurts, applesauce, smoothies, and mashed potatoes. Having these ready at home means you won't have to worry about meal prep when you're feeling sore. Avoid crunchy, spicy, or hot foods for the first few days after surgery. Set up a comfortable recovery area before you leave for your appointment. Arrange extra pillows to help keep your head elevated, which can reduce swelling and make resting easier. Place essentials like water, tissues, and ice packs within easy reach so you can relax and focus on healing when you get home. On the day of your surgery, wear loose, comfortable clothing with short sleeves. This makes it easier for your dental team to monitor you and place any necessary equipment. Avoid wearing makeup, jewelry, or contact lenses, as these can interfere with the procedure. If you have long hair, tie it back for convenience. Before you leave home, brush your teeth thoroughly to reduce bacteria in your mouth. If you're fasting, be careful not to swallow any water while rinsing. Good oral hygiene helps lower the risk of infection and sets you up for a smoother recovery. Double check that you have everything you need before heading out: your ID, insurance information, and any forms your dentist requested. Arriving prepared and on time helps the whole process go more smoothly and can ease any last-minute nerves. Take a few deep breaths and remind yourself that you've done everything you can to get ready. With these steps, you're well prepared for your wisdom tooth extraction. Now, let's take a look at what happens during the procedure itself. Here's what to expect in the surgeon's chair. First, you'll get anesthesia, local, IV sedation, or general, so you won't feel pain. If the tooth is fully out, the surgeon gently rocks and removes it. For impacted teeth, a small incision is made in the gum, and sometimes a bit of bone is removed. The tooth may be divided into smaller pieces for easier removal. You might feel pressure, but not pain. Once the tooth is out, the area is cleaned and stitched with dissolvable stitches. The whole process is routine and usually quick. Next, let's talk about what happens right after surgery. After surgery, you'll rest in a recovery room as the anesthesia wears off. You may feel sleepy or groggy. This is normal. Gauze packs help stop bleeding. You'll be shown how to change them. Expect some swelling and a little blood in your saliva. Avoid eating or drinking hot things until numbness fades. You'll get pain medication and instructions for home care. Your friend or family member will help you get home safely. Rest is your main job for the day. Now let's look at your first days of healing. The first 24 hours are crucial for healing. Rest and let a blood clot form. Don't spit, rinse hard, use straws or smoke. Swelling and bruising are normal. Use ice packs to help. Take pain medication as directed, ideally before the numbness wears off. Stick to soft, cool foods and avoid anything hard or hot. Drink plenty of fluids but sip gently, no straws. After 24 hours, gently rinse with warm salt water to keep the area clean. Brush your other teeth carefully, avoiding the extraction sites. Good hygiene and nutrition help you heal faster. Let's talk about handling any worries you might have. Feeling anxious about wisdom tooth removal is completely normal. In fact, it's one of the most common concerns people have when visiting the dentist. You might feel nervous about the unknown, worried about pain, or just uneasy about the whole experience. These feelings are valid, and you're definitely not alone. Many people feel exactly the same way before their appointment. The best thing you can do is share your concerns with your dental team. They're there to help. Dentists and their staff are trained to support patients who feel nervous or scared. Don't hesitate to talk openly about your worries, no matter how small they may seem. When you express your feelings, your dental team can explain each step, answer your questions, and make adjustments to help you feel more comfortable. One of the biggest fears is pain, but you won't feel pain during the procedure thanks to effective anesthesia. Modern dental techniques are designed to keep you comfortable from start to finish. Your dentist will make sure the area is completely numb before beginning, and they'll check in with you throughout the process to ensure you're okay. Afterward, some discomfort is normal, but it's usually manageable with medication and proper care. Your dentist will give you clear instructions for recovery, including how to manage swelling, what foods to eat, and when to take your medication. Most people find that the discomfort fades quickly, especially if they follow the aftercare advice closely. If you're very nervous, sedation can help you relax or even sleep through it. There are different types of sedation available, from mild options that simply calm your nerves, to deeper sedation where you might not remember the procedure at all. Your dentist can help you choose the best option for your needs and comfort level. Remember, you're always in control. You can ask for breaks or use a hand signal if you need a pause. Let your dental team know if you need a moment to breathe or collect yourself. They'll be happy to accommodate you. Bringing headphones and listening to music or a podcast can be a great way to distract yourself during the procedure. Focusing on something you enjoy can help take your mind off what's happening and make the time pass more quickly. The dental team truly wants you to feel safe and supported. They understand that dental anxiety is real, and they're committed to making your experience as positive as possible. Don't be afraid to ask for extra reassurance or comfort if you need it. Remember, you're in control and can always ask questions. No question is too small or silly. Your peace of mind is important. The more you know about what to expect, the more confident you'll feel. Facing your worries is a big step, and you should be proud of yourself for taking it. With the right support and information, you can get through wisdom tooth removal with confidence. You've got this. Wisdom tooth extraction is routine and safe. Millions have it done every year. By following your dental team's advice, you'll heal quickly and smoothly. Take time to rest and don't hesitate to call your clinic if you have concerns. There are no silly questions when it comes to your health. You're a partner in your own care, and you're well prepared for this. The procedure is often easier than expected. Soon, you'll be on the other side, healing and sharing your own story. You've absolutely got this.